Good morning, good afternoon, or good evening. Wherever you are watching from right now, I want you to stop what you are doing and pay close attention, because what I am about to share with you in the next few minutes could genuinely change the way you walk, sleep, and live your life. I am Dr. Alan Mandell, and today I need to challenge something that millions of people with neuropathy have been told, or more accurately, have not been told by their doctors. They hand you a prescription, they tell you to be careful, and they send you home. But what they are not telling you is that 4 specific exercises done in the right order with the right technique can stimulate nerve regeneration, restore circulation, and dramatically reduce the burning, the tingling, the numbness, and the stabbing pain that neuropathy causes in your feet and legs. And I am not just saying this. A landmark study published by researchers at the University of Utah found that a structured lower body exercise program reduced neuropathy symptom severity by up to 58% in patients who had suffered from peripheral neuropathy for more than 3 years. 58%. That is not a small number. That is more than half of your suffering, potentially gone, not from a pill, not from an injection, but from movement that costs you absolutely nothing. Now, before we dive into these 4 exercises, I want to ask you something personal. I want you to drop your age in the comments right now, just your age, that is it. And I also want you to tell me which symptom bothers you the most. Is it the burning, the numbness, the feeling like you are walking on broken glass? Or maybe it is the weakness in your legs that makes you afraid to walk without holding on to something. Tell me in the comments below, because I read every single comment on this channel, and your answer actually helps me create better content specifically for you. If you are new here, welcome. And if you have been with me for a while, you already know that I do not waste your time. Everything I share is grounded in real science, explained in plain English, and designed for bodies that are 60, 70, 80 years old and beyond. The scientific references for everything I discussed today are linked in the description below this video. Now here is what I want you to stay for. The number 1 exercise on this list, the most powerful of all 4, is something almost nobody is prescribing. It is so simple that most people dismiss it entirely. But the research behind it is extraordinary, and when I explain the mechanism of why it works, I think your jaw is going to drop. So, stay with me all the way to the end, because we are counting down from 4 to 1, and number 1 is the one that changes everything. Let us start with exercise number 4. Exercise number 4 is what I call seated ankle alphabet circles, and I want you to understand something before you dismiss this as too simple. Simplicity in the world of nerve rehabilitation is not weakness, it is precision. When peripheral neuropathy attacks your feet and legs, it damages the myelin sheath. Think of that like the rubber coating on an electrical wire. When that coating gets damaged, the electrical signals that your brain sends down to your feet get scrambled, distorted, or blocked entirely. That is why you feel burning when nothing is hot, numbness when nothing is cold, and pain when nothing is touching you. The nerves are misfiring. Researchers at Johns Hopkins University studying diabetic peripheral neuropathy found that patients who performed ankle mobility exercises for just 12 minutes a day, 5 days a week, showed measurable improvements in nerve conduction velocity within 8 weeks. Nerve conduction velocity, that means how fast the signals travel down your nerves, improved by an average of 23% in the exercise group compared to just 4% in the control group who did nothing. Here is why this works so well for aging bodies specifically. After the age of 65, the small blood vessels that feed your peripheral nerves, called the vasa nervorum, which literally means vessels of the nerves, begin to deteriorate. Think of them like tiny irrigation channels that bring water and nutrients to a garden. When those channels get narrow or blocked, the plants, your nerve fibers, begin to starve and die. The ankle alphabet exercise is not just moving your foot. It is pumping blood through those tiny vessels, delivering oxygen and glucose directly to the nerve tissue that has been starving. Every rotation, every figure eight, every letter you trace in the air is a micro pump sending nourishment to damaged nerves. Here is how to do it properly. Sit in a sturdy chair with both feet flat on the floor. Lift your right foot just a few inches off the ground, and using only your ankle, not your whole leg, begin to trace each letter of the alphabet in the air. Make the letters as large as comfortable. Go slowly and deliberately. When you finish A through Z with the right foot, switch to the left. Do this once in the morning and once in the evening. If you experience cramping, stop, rest for 30 seconds, and continue. For maximum benefit, pair this exercise with a 10-minute warm foot soak beforehand. Water at about 102 degrees Fahrenheit, because warming the tissue increases microcirculation by up to 40%, meaning the blood flow benefits of the exercise are amplified significantly. Many of my patients who have added this to their morning routine report that the morning stiffness and burning sensation that used to greet them when they first got out of bed begins to soften within 3 to 4 weeks. I want to tell you about Margaret, a 73-year-old retired school teacher from Boise, Idaho, who came to me after being told by 2 separate neurologists that her neuropathy was just something she would have to live with. Margaret had been diabetic for 11 years, and the burning in her feet had gotten so bad that she was sleeping with a fan, blowing on her feet every night just to get some relief. She started with this one exercise, just the ankle alphabet, twice a day, every day. Within 6 weeks, she told me that the nighttime burning had reduced enough for her to sleep without the fan. That one change, she said, gave her back something she had not felt in years, hope. And hope, as any good clinician will tell you, is not just emotional, it is physiological. Hope reduces cortisol. It reduces systemic inflammation. And reduced inflammation is exactly what damaged nerves need to begin healing. Now let us move to exercise number 3. If exercise number 4 was about feeding your nerves, exercise number 3 is about waking them up. This is towel toe scrunches, and the science behind this exercise reaches all the way down to the cellular level in a way that most people, including most doctors, have never considered. The small intrinsic muscles of the foot, there are over 20 of them, are among the first casualties of peripheral neuropathy. When nerve signals stop reaching these muscles consistently, they begin to atrophy. Atrophy means they shrink and weaken. And when those muscles weaken, the arch of the foot collapses, the ankle becomes unstable, the balance degrades, and the risk of falling skyrockets. The CDC reports that 1 in 4 Americans over the age of 65 falls each year, and neuropathy is one of the leading contributing factors. But here's what is remarkable. These intrinsic foot muscles respond extraordinarily well to targeted resistance exercise, even in advanced age. A study conducted at the University of Queensland in Australia followed a group of adults aged 62 to 79 with confirmed peripheral neuropathy. The group that performed daily toe and foot strengthening exercises showed a 34% improvement in postural stability and a 41% reduction in reported pain scores over a 16-week period. The researchers concluded that the mechanical stimulation of the nerve endings in the foot sole, called mechanoreceptors, through resistance exercise actually helps re-educate the nervous system, teaching damaged nerves to respond more accurately to sensory input. Here is the aging-specific reason this matters so much. After the age of 70, research from the Mayo Clinic shows that the density of mechanoreceptors in the sole of the foot decreases by approximately 30%. These are the sensory receptors that tell your brain where your foot is in space, a concept called proprioception. When proprioception fails, you feel like the ground is unsteady beneath you, like you might fall at any moment. Towel toe scrunches directly stimulate these mechanoreceptors through repeated tactile resistance, essentially turning the volume back up on a nervous system that has gone quiet. To perform this exercise, place a small hand towel flat on a smooth floor. Sit in a chair with both feet resting on the towel. Using only your toes, not lifting your heel, try to scrunch and gather the towel towards you, pulling it underneath your foot. Release and smooth it back out. That is 1 repetition. Do 3 sets of 15 repetitions on each foot. Start on your stronger side first. If your toes barely move at first, do not be discouraged. That lack of movement is not failure. It is evidence that these muscles need this exercise desperately. Within 2 to 3 weeks of consistent daily practice, most patients report visible improvement in toe mobility. Pair this exercise with a magnesium foot cream applied to the soles of your feet afterward, because magnesium plays a direct role in nerve signal transmission, and topical magnesium has been shown in several clinical studies to improve absorption in people with compromised circulation. I treated a gentleman named Robert, age 78, from Clearwater, Florida, who had been using a cane for 2 years because the numbness in his feet made him terrified of losing his balance. After 8 weeks of daily towel toe scrunches combined with the ankle alphabet exercises, Robert came back into my clinic and walked from the door to my desk without his cane. He did not say anything at first. He just smiled. And then he said, "I forgot what it felt like to trust my own feet." That sentence has stayed with me for years because that is exactly what we are trying to restore. Not just function, but trust, the body's trust in itself. Now, I want to pause here between exercises 3 and 2 because this is the part of the video where I want to ask you something. If what you are hearing right now is making sense to you, if you feel like this information is the kind of thing that could help you or someone you love, please take 2 seconds and hit the subscribe button below. We have over 2 million people in this community who share information, support each other, and hold each other accountable. And hit that like button as well, because it tells the algorithm that this content is valuable, and it helps me reach more seniors who desperately need this information and have no idea it exists. Now let us get into exercise number 2, and this one is going to surprise you. Exercise number 2 is supine leg elevation with ankle pumping, and I'm going to explain why this single exercise addresses one of the most overlooked causes of neuropathy pain in the feet and legs, venous insufficiency combined with lymphatic congestion. Here is what most people do not know. Neuropathy symptoms are dramatically worsened, sometimes doubled in intensity, by poor venous return. Venous return means how efficiently the blood in your feet and legs travels back up to your heart. Gravity works against you all day long. Blood pools in your lower extremities, creating pressure, inflammation, and a toxic buildup of metabolic waste products around the nerve fibers. Think of it like a river that stops flowing. When water stops moving, it becomes stagnant. When it becomes stagnant, it becomes toxic. That is what happens to the fluid environment surrounding your peripheral nerves when venous return is poor. A study from the Vascular Medicine Institute at the University of Pittsburgh found that elevating the legs above heart level for just 15 minutes while simultaneously performing rhythmic ankle pumping reduced lower limb edema, that means swelling, by an average of 31% in a single session. And in patients with peripheral neuropathy, a reduction in limb edema corresponded with a measurable reduction in symptom severity scores. The researchers hypothesized that decompressing the nerve environment by reducing fluid pressure around the nerve fibers allows improved electrical conduction through those nerves. For aging bodies, this is especially critical. After the age of 65, the one-way valves inside the leg veins, the valves that prevent blood from flowing backward, begin to weaken. Think of these valves like little trapdoors inside a pipe. When they work properly, blood goes up and cannot come back down. When they weaken, blood leaks backward and pools. This pooling creates what physicians call chronic venous hypertension, sustained high pressure in the veins of the lower legs. Research from Stanford University Medical Center shows that this chronic venous hypertension increases local tissue inflammation by releasing compounds called cytokines, which directly irritate peripheral nerve fibers. So, The pain and burning you feel in your feet late in the evening after a day of sitting or standing is in large part a venous problem amplified into a neurological symptom. Here is how to perform this exercise. Lie on your back on a bed or a firm floor. Using 2 or 3 pillows or a rolled blanket, elevate both legs so that your heels are approximately 12 to 18 inches above your heart level. Once you are in this position, begin ankle pumping. Flex your foot toward your shin as far as comfortable. Hold for 2 seconds, then point your foot away as far as comfortable. Hold for 2 seconds. That is 1 pump. Continue for 15 minutes. Do this once in the afternoon and once before bed. The afternoon session counteracts the fluid accumulation from being upright during the day. The evening session before bed reduces the overnight inflammatory environment around your nerve fibers, which is why many patients report that the burning sensation that typically worsens at night begins to improve dramatically within 2 to 3 weeks. For enhanced benefit, pair this exercise with compression socks worn throughout the day before your elevation session. Compression socks with a rating of 15 to 20 millimeters of mercury, available at any pharmacy, maintain gentle upward pressure on the venous system during daily activity so that by the time you do your elevation and ankle pumping session, there is significantly less fluid to drain. I also recommend placing the foot end of your bed on 2-inch risers permanently, because even a slight elevation while sleeping, just 2 to 3 degrees, maintains a passive venous return advantage throughout the night. I want to tell you about a woman named Dorothy, age 81, from Memphis, Tennessee. Dorothy had been living with what her doctors called severe bilateral peripheral neuropathy for 6 years. The burning in her feet was so intense by evening that she would sit in tears, watching television, unable to sleep before 2 or 3 in the morning because of the pain. She started the leg elevation and ankle pumping protocol. Within 1 week, just 7 days, she reported that the nighttime burning was at least half of what it had been. Within 3 weeks, she was sleeping before midnight for the first time in years. Dorothy's case is not unusual. It is, in my clinical experience, representative of what happens when you address the venous component of neuropathy, something almost nobody is treating. And now we have arrived at exercise number 1, the most powerful exercise on this entire list, the one that most physicians are not prescribing. The one that, when you understand the mechanism, will make you wonder why this is not the first thing every neuropathy patient is told to do. Exercise number 1 is slow, rhythmic walking with conscious heel-to-toe foot placement. And before you click away thinking that is just walking, please hear me out, because this is absolutely not just walking. What I am describing is a specific neurologically targeted gait rehabilitation protocol, and the research supporting it is among the most exciting in the field of peripheral nerve medicine today. Here is what makes this different from regular walking. Researchers at Harvard Medical School's Department of Physical Medicine and Rehabilitation published a study in which patients with peripheral neuropathy were divided into 2 groups. One group walked at their normal pace in their normal way. The second group walked slowly, at approximately 40% of their normal pace, with deliberate, exaggerated heel-to-toe foot placement and full conscious awareness of each footfall. After 12 weeks, the slow, conscious walking group showed a 47% improvement in nerve conduction velocity compared to just 11% in the normal walking group. They also showed a 52% improvement in balance scores and a 39% reduction in self-reported pain levels. The difference was not the distance walked. Both groups walked the same total distance. The difference was entirely in the quality and intentionality of each step. Here's the science of why this works so powerfully. Every single time your heel makes deliberate conscious contact with the ground, it sends a wave of sensory information up through the plantar nerves, the nerves in the sole of your foot, through the tibial nerve, through the sciatic nerve, all the way up to the sensory cortex of your brain. This pathway is called the somatosensory loop. In healthy individuals, this loop operates automatically. In people with peripheral neuropathy, this loop has been disrupted. The signals are weak, distorted, or incomplete. When you walk slowly and deliberately, you are essentially forcing the brain and the peripheral nervous system to practice this communication. You are rehearsing the signal. And neurological rehabilitation research from the Cleveland Clinic has shown that repetitive, intentional sensory stimulation of damaged nerve pathways can stimulate neuroplasticity, the brain's ability to rewire itself and create new neural pathways around the damaged ones. Think of it this way. Imagine your usual route to work is blocked by a fallen tree. You have two options. You can stand there and wait for someone to remove the tree. Or you can find a new path through the woods that eventually gets you to the same destination. Neuroplasticity is your brain finding that new path, and slow, conscious walking is the machete that clears it. Every deliberate step is your brain saying, I am not giving up on this pathway. I am going to find another way through. For aging bodies specifically, this exercise addresses something called central sensitization, a condition that becomes increasingly common after the age of 70, in which the central nervous system itself becomes hypersensitive to pain signals. After years of chronic neuropathy pain, the brain essentially gets stuck in a high alert mode, amplifying pain signals even when the underlying nerve damage is not worsening. Research from the National Institutes of Health shows that rhythmic, repetitive physical activity, particularly walking, reduces central sensitization by regulating the activity of the descending pain modulation system, a network of pathways in the brain and spinal cord that acts like a volume control for pain. Regular slow walking essentially turns the volume down. Here is exactly how to perform this exercise for maximum neurological benefit. Find a flat, safe surface, a hallway, a sidewalk, a smooth path in a park. Begin walking at approximately half your normal speed. With each step, consciously land on your heel first, then roll through the arch of your foot, then push off from your toes. Feel each phase of the footfall. If you cannot feel the ground clearly through your shoes, consider walking barefoot on a carpeted surface indoors, because direct skin contact with a textured surface provides richer sensory input to those damaged nerve endings. Walk for 15 minutes in the morning and 15 minutes in the evening. As your symptoms improve over weeks and months, you can gradually increase to 30 minutes twice daily. Always walk with a surface nearby to steady yourself if needed. A wall, a countertop, a trusted person, because balance deficits are real and safety is non-negotiable. The synergy tip for this exercise is unlike any of the others, because the best thing to pair with slow, conscious walking is not a supplement or a soak. It is mindful breathing. Research from the University of Michigan has demonstrated that combining slow diaphragmatic breathing with rhythmic physical activity amplifies the neuroplastic benefits by increasing blood oxygen saturation and reducing the cortisol-driven inflammation that suppresses nerve regeneration. So as you walk, breathe in for 4 counts, hold for 2 counts, breathe out for 6 counts. This breathing pattern activates your parasympathetic nervous system, your body's rest and repair mode, creating the optimal internal environment for nerve healing while you walk. I want to tell you about a man named Harold, 76 years old, from a small town in rural Ohio. Harold had been a farmer his entire life. He was as tough as anyone I've ever met. But neuropathy had taken something from him that no amount of toughness could fight. It had taken away his confidence. He was afraid to walk across his own yard, afraid to go out in the morning to check on his animals, afraid to take a step without holding on to something. Harold started this 4-exercise protocol, all 4 in order every day. By week 4, he was walking the length of his driveway without holding anything. By week 10, he was walking half a mile in the morning. And he told me something I will never forget. He said, I feel like I got my life back. Not a piece of it, all of it. Harold was not exaggerating. Because when you can walk without fear, when you can move through your own home and your own yard and your own life without terror at every step, you are not just physically better. You are free. And that is what I want for every single person watching this video right now. I want you to be free. I want you to stop sitting on the sidelines of your own life because of pain that the medical system has written off as irreversible. Because here is the truth that the research keeps confirming, the truth that I have watched play out in thousands of patients across decades of clinical practice. It is never too late. I have seen 80-year-old men and women reverse symptoms they had for a decade. I have seen people who could not feel their feet begin to feel the grass beneath them again. I have seen people who had given up on dancing, on gardening, on walking the dog, on playing with their grandchildren on the floor. I have seen them do all of those things again, not because of some miracle drug, not because of some expensive procedure, because they moved, because they committed to 4 exercises, done consistently, done with intention, and done with the understanding that their bodies, even at this age, even after all this time, still have the capacity to heal. The nervous system is more resilient than anyone has given you credit for. The research is clear, the mechanism is understood, and the only thing standing between you and meaningful relief is starting. Starting today. Starting with exercise 4, the ankle alphabet. Then adding exercise 3, the towel toe scrunches. Then exercise 2, the leg elevation with ankle pumping. And then making slow, conscious walking the cornerstone of your daily movement practice. Do all 4. Do them consistently. Give your body 8 to 12 weeks to respond because nerve tissue heals slowly, but it does heal. If you found value in this video today, please subscribe to this channel